Hi, everyone. Welcome back to the CGA podcast. Today we have Dr. Amy Otto. She is an assistant professor in the Department of Public Health Sciences in the Miller School of Medicine. And she is also an assistant professor in the Department of Cancer Control program at the University of Miami Sylvester Comprehensive Cancer Center. Welcome today to the podcast, Amy.
Thank you for having me.
Very exciting. So we're going to be talking about a paper that you had this year in JCO Oncology Practice. And the title, just for our audience to know what we're talking about today, is The Impact of Patients' Companions on Clinical Encounters Between Black Patients and Their Non-Black Oncologists. And you are the lead author, but you have a few helpers on the paper as well. So we always want to respect all the authors for putting together this great work. So thank you again for coming on just to talk about the paper, give us kind of the rundown and the highlights, and let us know where the field's going.
Yeah, my pleasure.
Yeah, so looking at the publication, what were the major goals and findings of the article?
So this was a secondary analysis of some data that some of those helpers you mentioned, some of my co-authors at Karmanos Cancer Institute in Detroit had collected as part of a larger randomized controlled trial that they had done looking at the effects of a question prompt list intervention for Black cancer patients, although the paper that we're talking about today wasn't concerned with the intervention itself. So these data were pulled from an initial treatment planning encounter that the patient had with their medical oncologist. All of the oncologists in this study identified as non-Black. So these were all racially discordant encounters, meaning that the patient and the oncologist identified as different races. So these encounters were actually video recorded, and then later some trained coders coded the communication behavior during the encounter based on those recordings. And then immediately after the encounter, the patients and the oncologist each actually did a short self-report questionnaire about some of their perceptions of the encounter and of each other. So the main goal of this paper was just to sort of better understand the ways that a family caregiver or a companion can affect these racially discordant clinical encounters between Black patients and their oncologists. Specifically, we wanted to look at first whether there was any impact just of a companion being present in the encounter, regardless of what they actually did during the encounter. And then second, if there was a companion, whether them being sort of more actively engaged in the encounter had any impact. And we're really interested in communication behaviors. So the patient's level of active participation, the oncologist's use of patient-centered communication are our primary outcomes. And then we're also interested in perception. So how did the patient feel about the treatment that the oncologist recommended? How did the oncologist perceive the patient in terms of how likely they were to be adherent, or how engaged they were, how many questions they asked, and things like that? So in general, we sort of expected that having a companion and having a more active companion would be associated with quote unquote better outcomes. So more active participation from the patient, more patient-centered communication from the oncologist, and just better perceptions of the encounter and of each other.
Even to take a step back, I mean, really what led to the concept, how you even got to that study design and, thinking through the cohort and everything and pulling the data?
It's a great question. So my personal sort of expertise and interests are really around dyads coping with cancer. So a cancer patient and their primary caregiver or other sort of support person that they have in their life, and how the cancer experience affects quality of life of both people and how they communicate with each other about cancer. More recently, I've been interested in exploring how that family caregiver might impact patient-provider communication or patient-provider interactions, which might ultimately tell us something about how the caregiver could be leveraged to improve those interactions and ideally patient outcomes kind of farther down the line. So I got connected with Dr. Susan Egley, who is the senior author on this paper at Karmanos Cancer Institute, because I knew of some data that she had that could potentially help answer this question. It was a really exciting data set because of the racial makeup of the patient and the oncologist population there. So I mentioned that the patients were all Black. They had to self-identify as Black as a condition of participating in this parent RCT. There actually wasn't any exclusion criterion for oncologists based on race, but none of the participating oncologists identified as Black, which meant that we had this really interesting data set where all of these encounters were racially discordant. And this is reflective of the real experiences of Black cancer patients in the US. The number of Black practicing physicians in the US, I believe, is only about 5% of all physicians, and an even smaller percentage of oncologists are Black. So this is sort of a really relevant, sort of applicable data set to look at. And we know that from other research, communication tends to be worse in these types of racially discordant encounters. And Black patients and non-Black physicians tend to have more negative views of each other than they would if they were the same race. So we think that these differences in communication and perceptions or attitudes could be really important things contributing to racial health disparities in cancer. And this whole separate body of work shows that having a caregiver or other support person present during other types of medical encounters can help improve some outcomes like better patient satisfaction and better understanding on both the part of the patient and the provider in terms of what was discussed during that encounter. But almost all of that work is done in non-Hispanic white patients. So overall, this just seemed like a really great opportunity to sort of marry these different areas and address this gap in the literature.
What did the results show?
So just on a descriptive level, we saw actually that less than half of the patients brought a family caregiver or companion to the encounter, which is pretty consistent with what my collaborators at Karmanos saw in some of their previous work, that around 40% of Black patients tend to be accompanied to oncology encounters compared to about 86% of white patients, which is really noteworthy.
Wow.
In terms of the impact of having a companion or not having a companion, we saw that oncologists were coded as using more patient-centered communication when there was a companion present. And they also perceived those accompanied patients as being more engaged in asking more questions during the encounter. We did find that oncologists spent more time with accompanied patients, about 6 minutes on average, which was 20% higher than the average encounter for unaccompanied patients, which obviously can present some logistical challenges for providers and clinics. If every encounter was 6 minutes longer, that might potentially present a problem, but that does present an opportunity for more information to be exchanged, and longer encounters are associated with a lot of good outcomes, like more patient-centered communication, higher patient satisfaction, and things like that. So something worth thinking about. And then we also saw that oncologists thought accompanied patients had more social support than unaccompanied patients, which is probably not that surprising. But that could also have some clinical implications. So that is something else that's sort of important. If a treatment that's being considered requires really substantial social support or caregiving for the patient, then an oncologist might sort of consciously or intentionally or not spend less time discussing that treatment option, or they might present it differently or maybe not recommend it as strongly to a patient that they think has low social support. Obviously, I'd like to see some more research on that to really understand the relationship between kind of perceptions and treatment recommendations and how the companion might play into that. But again, something kind of important to consider. And then the last thing was that we saw that in terms of the impact of the companion's level of participation was that having a more active or engaged companion was associated with more patient-centered communication from oncologists.
What are you hoping the impact will be of this paper in particular?
That is a really good question. I think at a really basic level, I hope that it might prompt providers to really just think about the role of the caregiver or companion in a clinical encounter and what the provider might be able to do to further facilitate their inclusion. I hope that those providers that aren't already really encouraging their patients, and particularly their Black patients, to bring a support person to their appointments might start doing that and helping patients problem solve or find workarounds if they have a support person who isn't able to come. For example, during COVID pandemic, I know at my previous institution, a lot of family members were being included in appointments by phone or by video call just because they weren't allowed to be in the hospital. I hope that things like that could potentially continue beyond the pandemic when there is a support person that might be, interested in being involved and they just can't make it to the appointments.
And when you were working with the data, were there any challenges to finalizing the work?
So as I mentioned, these data were from my collaborators at Karmanos. So I wasn't personally involved in the data collection, but one of the biggest challenges with this type of research is how difficult it is to get video recordings of clinical encounters in the first place. That's a pretty big undertaking. And it's also really time and resource intensive to get these video recordings coded by trained observers. And it can also be really difficult to just get questionnaire data from providers in this way. I'm sure we're all painfully aware providers' time is really at a premium. So it can be tricky to carve out even an extra minute or two after an
Yeah.
encounter to do a questionnaire like this.
No, that's good. I have a little bit of experience with that, and I know I appreciate how much goes into those types
Yeah.
of visits. Is there anything that you wish you could have added or didn't think needed to be in the article?
I think most of the things that I wish that we could have added are things that we really couldn't have added given the data that we actually had in the data set. I really would have loved to have more data on the companion in particular. I think who they were to the patient, for example, like were they the patient's spouse or their friend or their neighbor who just happened to give them a ride to this one appointment, and what the companion's own perceptions were, their experience of the encounter. It would also be really great if we could go back into those video recordings and have the companion behaviors coded a little bit more specifically. So, not
Yeah.
just were they there or how actively they were participating in general, but what specifically were they doing and saying during that encounter that was
Hmm.
helpful or maybe not so helpful? And also, I think it would be really great to have some longer term data on clinical outcomes and quality of life for patients and the companions too.
Yeah, absolutely. It would add a lot of light to this.
Yeah.
So, what are you working on now, and where do you think this field's going?
Yeah, so I'm currently working with Dr. Egley and my other collaborators from this paper on another paper that is based on the same data set, which is trying to get at some of these more specific things that companions are doing and also some of the more specific things that providers and patients are doing. So we're looking at some aspects of the specific language that all three of these people are using during the encounter and its impact on some of these same outcomes. One thing we're really interested in is how something really small, like using words like we and us, these kind of words that might contribute to a sense
Hmm.
of being a team together, might be related to some of these other communication behaviors and the perceptions that everybody has of that encounter.
Yeah, that's really interesting. Well, thank you for coming on today. This was a very nice rundown of the paper. And for those who have not looked at it, please go back. Again, it's in JCO Oncology Practice, came out this year. Impact of Patients, Companions on Clinical Encounters Between Black Patients and Their Non-Black Oncologists. Thank you so much, Dr. Otto, for coming on and sharing your experience pulling together this work. And it's exciting to see that there's a lot of avenues going forward.
Yeah, thank you for having me.